Hey again, Dr. Walker from dentalwalker.com. Welcome back to the channel. And again, give me a like, give me some thumbs up so I can know that you like what we're doing and we can continue doing what we're doing. Anyway, today I'm going to talk a little about spike proteins and what they mean for us short-term, long-term, and how we get them and so forth. So one of the issues with spike protein is that, as we all well know, it causes significant inflammation within the system. Now, a common way, not the only way, but a common way, not the only way, a common way of getting spike protein in the system is getting a COVID infection. And once a COVID infection happens, traditionally it takes about 14, 21 days thereabouts to get the clearance of the spike protein process and reduce the inflammation. So you may feel a little sluggish or so still, for 3 or 4 weeks out, but for the most part, it wanes itself and kind of goes away. But there's a thing called long COVID, in that many people, or some people I should say, still have the persistent brain fog, malaise, fatigue, can't sleep, can't focus, because they have long COVID. And that typically lasts essentially for some people a year, past a year, right? I have a friend of mine that she's now dealing with the same spike protein long COVID issue for about 2.5 years now, in that when she checks her blood levels in terms of the amount of spike protein that she has, it's still the same for a couple of years now. And traditionally, when you get like a flu or some other viral infection, the normal, natural way, those antibodies in the system, after the body sort of handles it, addresses the whole inflammatory process, the antibodies in the system, in the serum, goes away into your bone marrow, and it kind of goes hidden for a while. And it gets out of the main circulatory system. Now, if it does not, again, that's where the conventional idea of long COVID comes into play. Now, Dr. Peter McCullough, gave his view of how to essentially address the chronic spike protein levels, in that he called it the detox method. Well, I look at it more of an inflammatory, decrease in the inflammation process, more so than a detox per se. Now, and he gives 3 things that he says he would suggest to folks for them to decrease their overall, that whole malaise, fatigue, tiredness, can't sleep, can't focus, right? All of those things, part of the brain fog issue with long COVID. He gives his idea in terms of 3 things he would actually do: nattokinase, bromelain, and curcumin. Now, let me say this: nattokinase, perhaps one of the best supplements on the market. Now, before, a lot of folks would, for reducing clot formation, clot burden in the system, or not making them bigger, a lot of folks would use aspirin. But then we found out that there are lots of complications just with aspirin in and of itself, right? Lots of problems with aspirin, to include it just damages your gut lining, it damages your kidney, causes leaky gut syndrome, and by definition, by default, if you have leaky gut syndrome, then you're prone or predisposed to having things like autoimmune disorder, like Graves' disease or Hashimoto's disease. All of those are autoimmune disorders, and a part of that spectrum of leaky gut syndrome, LEAKY gut syndrome, again, predisposes you to that sort of stuff. And so what nattokinase can do that is more so important than aspirin, in that it doesn't hurt your gut, doesn't hurt your kidneys, it doesn't do any of that. But what it does is it does the same thing essentially from the standpoint of clotting, same thing as aspirin can do, again, but it doesn't hurt your gut. But more importantly, it also then, small clots, it'll help to break those small clots down, which is a great thing. So it does 2 things. 1, it prevents clot from forming or getting bigger. And 2, it breaks down small, tiny clots before they become a problem. And as you well know, if you have a clot, for example, in your lower extremity, DVT can propagate into your lung, called a PE, and then you could have some complications from that, right? So anytime you increase risk for clot formation, you increase risk for a lot of other things, to include strokes, DVT, PE, that sort of stuff. So nattokinase is a great supplement. Now, it is it's a organic soybean product. And what that means is, it's what it is, right? And so it comes in several forms. It comes into a sort of a bean method. Can also come into a tablet or a pill. Comes into a powder. Now, the idea with this is to have maximized absorption. So one way of maximizing the absorption is to take it either about a half hour before or an hour after your meal. So half hour before your meal, or an hour after your meal. But a lot of folks will just add it to they're having some rice or some meat or some fish, add that to their food and eat it that way. It looks and smells almost like blue cheese, has the same kind of texture and smell. So a lot of folks will have, or some folks will have that problem in terms of the smell of it, but for the most part, I think a lot of people do fine with it and eat it that way, mix it into your food and eat it. And again, it just does so many wonderful things for you, anti-inflammatory, and not to include the rest of the stuff that people always sort of added to, and that it also helps with malignancies and cancers and diffuse inflammation and that sort of stuff. So all of those things, yes, but it also, and importantly, it not just decreases inflammation, but also decreases your risk for clot propagation, getting bigger and so forth. So that's a great thing. And he suggests 2,000 units per day for nattokinase. The other one he mentions is bromelain. So bromelain is sort of a pineapple extract. People take bromelain for a couple of reasons. One, for just diffuse inflammation that they have, sinus disorder, sinus infection, sinus, that sort of stuff. And a lot of people also take it for allergies, right? So like seasonal allergies, a lot of people will take it for that. Bromelain is one of those things that help to transport, to absorb things like quercetin, Quercetin. And quercetin by itself is one of those things that help to mobilize or transport zinc into the cell. Once zinc is inside the cell, not outside, inside the cell, it becomes lethal to many, 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 many viruses. So a lot of folks will take quercetin with bromelain, again, just to have the absorption rate for quercetin for the individual. But once quercetin gets involved, it transports zinc across the cell. So if you have a virus, you have a cold, you have even COVID, right? That's where that part comes in. But bromelain is a great anti-inflammatory in and of itself. For sinus disorders, skin disorders, allergies, great thing. He says take 500 milligrams daily for bromelain. And the last thing, which I'm surprised that more people don't have this already in their arsenal of foods or things that they eat or supplements that they take, turmeric, curcumin. He suggests doing that. 500 milligrams you can do twice daily with that. Now, what that does, again, it's a tremendous, tremendous anti-inflammatory, and people have been taking it for years. It's typically a part of the Asian, Chinese cuisine, Chinese, Indian cuisine, Asian in general cuisine. Again, a very, very powerful, wonderful anti-inflammatory. In this case, it also helps to decrease the risk in which viral particles get attached to your system. So it decreases viral particle load, essentially, being attached to your system. Again, the whole cascade of things, as I said before, when you have excess spike protein in the system that's going on chronically, so greater than a month or so, it causes significant inflammation, to include things like blood clots and DVTs and PEs and strokes, and all of those things can come. So curcumin, again, one of those anti-inflammatory that decreases the risk of sort of viral load being attached to your system, and also decrease overall inflammation. Now, curcumin is one of those foods you want to take with a little bit of fat as well, one. And two, the other thing you should do with curcumin, turmeric, is take it with a little bit of black pepper. Black pepper is alleged to increase potency of turmeric like 2,000%. Crazy number. So what I do for myself, I take a salt shaker, I fill it 2/3 with curcumin and turmeric, and then 1/3 of that is black pepper. And so I kind of shake it up. It's on my table. When I have dinner tonight, I'm going to take a little bit of that and just add it onto my meal. It's great for arthritis, it's great for joint pain, great for back pain, great for, right, just a whole list of things. It'll help to decrease. Now, it's marketed in this discussion. We're talking about it as an anti-inflammatory process, but also for like joint pain and those kind of things, it does a tremendous job in reducing those disorders. And some would actually say that 1,000 milligrams of curcumin works just as well as the 500 milligram of Advil, which is, again, one of those things. And NSAID, this is not going to cause you any disorder to your GI system, to your gut, to your kidneys. None of that. Just a great, great anti-inflammatory. And again, those three things should work. And again, should work from a standpoint of decreasing overall inflammation. Again, inflammation is sort of the precursor to many, 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 many diseases, to include malignancy. So if you can reduce your inflammation overall, you should be fine. So again, he gives nattokinase, bromelain, and curcumin. Nattokinase is 2,000 units per day, and again, in sort of in any format you can take it. Bromelain, 500 milligrams daily, and curcumin, he suggests 500 milligrams twice per day. And those things should work for folks in terms of decreasing overall inflammation. Anyway, Dr. Walker, let me know in the comments if you've tried that before, if it works for you, and let others know as well that they can try these things to decrease overall body inflammation. In this setting, inflammation secondary to things like COVID, long COVID, and again, you can get COVID from, not COVID, you can get spike proteins from many things. One of those things is just having the COVID infection in and of itself, but from other things as well. Thanks for listening, Dr. Walker.